means a more complex closure. This may also mean, probably does mean shoulder surgery. So just don't forget to look for that. Okay. Other things to look for. Shoulder pain can be nonspecific. And if a patient points here, it's kind of like a 5-year-old saying, where does your belly hurt? Where do they point? Here. They all point here until they get to maybe 12 or 14 years old. And all of a sudden they're like, I think it could be my appendix. But that's over here. My pain's here. That's how kids work. But fractures of the shoulder and of other complex joints are really no different. Anything in the shoulder area is fair game, including the scapula. So here's a fracture of the scapula. That's the spine of the scapula. Here's a fracture of the body of the scapula. Okay, scapular injuries, by and large, are not good things to see. If you see a scapular injury, you're dealing with something that required a lot of force, because that bone is designed to serve as a shield of the posterior thorax and also as an attachment point for muscles that are responsible for upper extremity strength and mobility. That's a durable bone. It's not supposed to snap. See what I'm saying? So the amount of force that's required for a scapular fracture starts at the body, hits the bone, and then that shock wave transmits through to the soft tissue of the pleura, into the lung, into the mesentery, into the vessels, into the heart, and it causes things like pneumonia, pulmonary contusions, mesenteric bleeds, aortic dissections, a bunch of bad things that you don't want to miss. And you wouldn't think about that if you see a scapular fracture, all right? So think about this. A scapular fracture alone has 2 to 5% mortality. That's a lot. Now, I've probably seen about 15, maybe 20 scapular fractures in my career. That means that, statistically speaking, probably one of those patients has died. That's kind of crazy. So isolated scapular fractures, believe it or not, are going to walk in to your urgent care. They're going to walk into your primary care office. They're going to walk in to healthcare facilities and say, I fell, what do I need to do? And it literally may be, an illegal immigrant that's been working on a job site doing landscaping and fell 20 feet off of a ladder onto the corner of a sprinkler head, right? Mechanisms and presentations are not going to be typical, but your recognition should be. That's kind of the take-home point. 32% of a pneumothorax, 41% develops a pulmonary contusion. The big problem with pulmonary contusion is the subsequent pneumonia that causes as well. So if you see a scapular fracture, my recommendation is to follow it up with a CT. Simple, cut and dry. Look at the actual organs, make sure there's no visceral injury, and then rule that out, okay? Otherwise, the vast majority of scapular fractures, really by and large, are not a big deal. A little sling management, and they'll treat themselves on their own.
So would you just order a chest CT without contrast or one with contrast?
Good question. It depends on the mechanism and the age of the injury. Obviously, if you're probably a week after the injury and the patient isn't short of breath or having signs of pneumonia or a cough, you probably are okay with non-contrast. You honestly probably are okay without any imaging. It's the acute setting that you're worried about. A pure trauma study should be IV contrast only. Ironically, those are easier to order from the outpatient setting than they are in the ER setting, because we have so many rules about renal function that have to be advised. Remember, though, renal function should be thrown out of the window when you're worried about trauma. So the pure study will always be IV contrast. That lets you see visceral organ injury as well as bleeding. Okay. Here's your normal AC joint. This is your acromion, your coracoid process, and your clavicle. Does that kind of ring a bell from yesterday? The structures that you felt when you did the shoulder, well, now you see them anatomically. Kind of hits it home. In fact, this is where you did your shoulder injection yesterday. See what we did there? Okay. Those are your bones. These are your ligaments. These ligaments are the ones that are designed to provide support for the shoulder, at least from a structural perspective.